So platysmal bands are vertical bands of usually the medial border of the platysma that come from the chin and descend all the way down towards the collarbones. These show up in certain patients. It's a genetic and time on earth phenomenon. They tend to get worse and not better over time from the effect of gravity on the muscle and just the laxity that is introduced as the collagen and elastin relaxes and the skin and the muscles sort of stretch a little bit. And so there's a few treatment options that work. Things that I have not had great success with are neck tightening creams or even kind of skin tightening devices for platysma bands, because those treat the skin over top, which is maybe part of the problem. But oftentimes if that neck muscle needs to be addressed in some manner, then patients are sort of left with something to be desired after starting out with those superficial treatments. So there's a few options for treating vertical bands, including Botox, which is an FDA approval for platysma bands, and those can reduce by weakening the muscle with injections. And those can be great temporary treatments, and sometimes over time they can cause a more lasting improvement for some patients in certain cases. A lot of patients need those bands to be tightened. And so, patients who've tried that or failed it or don't want to keep it up will often ask us about, is there an option where I could just tighten these bands to get rid of them and create that neck fullness? And that's a platysmaplasty. And so that involves a small incision under the chin. We go in and we tighten the muscle. If there's a little bit of liposuction that needs to be done, we often do it at the same time. Some patients don't need it, some patients do. But that allows, basically, it's a very minor procedure, can be done under a local or very light, kind of like Xanax style pill. And we can just tighten up those bands, and sometimes we treat the skin at the same time. If you have vertical bands that are going from the chin down to the clavicles that are visible, and you can see them on both sides, then a platysmaplasty might be a good option for you. A platysmaplasty alone is not a great option when we have this deeper central neck fullness, when we can start to see things like glands or fat that are coming down, and those signs of deeper neck structures. Usually a platysmaplasty is not enough. And so it's an option for you, but those patients tend to move more towards a deeper neck lift procedure because it's going to provide them a more definitive improvement rather than just tightening that hammock muscle over the top. Recovery for a platysmaplasty is, I tell patients it's usually 10 to 14 days of bruising and swelling. And so just raising up that skin to get to those muscle bands is going to cause some swelling in this part of the neck. Patients usually wear a head wrap for a few days, especially, and then at night for a few weeks afterwards, just to keep everything healing in the position that we put it. There is some tightness that you feel from the center muscles being tightened with sutures, but that doesn't last as terribly long. So it's more so the bruising and swelling that kind of causes the downtime. And so for patients who are remote with work or have the time, it's a fairly straightforward recovery for the vast majority of patients.